News Conference. We're going to be talking about goals and outcomes and a framework for renewing the Joint Office Intergovernmental Agreement between the City of Portland and Multnomah County for the next 3 years, starting July 1st. I will begin things by handing over to our chair, Jessica Vega-Peterson. Thank you.
Gotta lower that mic. Good morning, everyone. Thank you so much for being here. I'm Jessica Vega-Peterson, Multnomah County Chair. I'm so glad to be joined today by Mayor Wheeler to unveil a comprehensive approach to addressing homelessness that is co-created and will be co-led by our two governments. This approach will allow us to extend the intergovernmental agreement between the city and the county around the core work of the Joint Office of Homeless Services, which includes homelessness prevention, shelter operations, outreach, and housing placements. Our IGA is set to expire in 6 months, and we've been working intensely to develop this approach and a new way forward for our community. Most importantly, the framework we are unveiling today will allow us to dramatically expand our coordination of homelessness response across our respective departments and bureaus and get us truly aligned in dealing with the crisis people are experiencing on our streets. The Joint Office of Homeless Services was founded nearly 8 years ago. Prior to its founding, the city and the county divided responsibility for addressing homelessness, with the city primarily addressing homelessness for single adults and the county primarily addressing homelessness for unaccompanied youth, families, and survivors of sexual and domestic violence. The Joint Office was created with the laudable goal of standing up a more holistic system and breaking down inefficiencies and challenges in the silos of this long-standing partnership. But in actuality, the Joint Office's authority didn't extend to key areas needed to address homelessness, like the production of affordable housing and the need for behavioral health services for many living on our streets. Without these key partnerships, the Joint Office was left to solve problems it sometimes didn't have the right tools for. And frankly, the partnership between the city and county that was needed to truly have a joint and coordinated response to addressing homelessness was not in place. And so what was a fractured and siloed system had remained that way despite the good intentions and strategic vision of many. As the problem on our streets grew, so did the expectations of the Joint Office and frustrations around our ability to solve it. Our current Joint Office Director describes his role as being at the end of a funnel, dealing with everything that's spilled out of systems that he has no control over. Today, we are taking a huge step to correcting that. The proposal we're sharing with our commissioners turns the page on a relationship that has been fraught with misunderstanding and mistrust, and worst of all, a system that is not as effective as it should be. And it moves us towards a genuine partnership rooted in collaboration and cooperation. Building the trust to get to this point has been key, and that has taken time and effort. And while the mayor and I haven't always agreed, and won't always agree to be frank, we share several goals. Among them is a commitment to working together, putting aside disagreements, and not getting stuck in the past in a way that prevents us from forging ahead. Because that is what our community should expect. It's what our taxpayers should expect, and what the thousands of vulnerable people who will be spending tonight living in unsafe and unsheltered conditions absolutely deserve. Because at the end of the day, this is not about shelter beds. It's not about rental assistance or the efforts to build more affordable housing. It is about those people. So today I'm here to share a vision of the community we want for the people of Multnomah County and the city of Portland. Because both the mayor and I believe in the city and the county that you believe in. One that's filled with opportunity, safety, health, and belonging. One where homelessness is rare and brief, and people, no matter their race, age, or income level, have homes that they can afford. One where the community is at the table to help us make decisions that will take us from where we are to where we need to be. One where people have the opportunity and support to take the next steps in what their lives can become. We believe that this new approach will help us significantly in our efforts to achieve that vision. More specifically, at the heart of these new agreements is the establishment of a homelessness response system that includes joint goal making, strategic formation, and oversight over the larger system of care. And there are 3 keys to effectively creating and implementing this response system. First, key performance metrics to assess the work of the Joint Office of Homeless Services. We have to be pointing in the same goals and outcomes and driving there with force and discipline. This includes identifying a baseline number of people experiencing unsheltered homelessness as of January 2024. It includes refining our data collection and data management systems to provide quarterly reports on our goals. And it includes making sure all of our providers are contributing data and information to our data system so that we can establish and maintain daily shelter availability. We'll have the data to closely monitor our progress, to make sure providers are able to talk to each other effectively, because through our data, we'll know the specific circumstances of the people living on our streets. This focus on expanding and strengthening our budget, data, and reporting requirements will help with transparency and planning across our governments. It will tighten the screws of our system, and it will ensure that what we say is going to happen, that we're going to provide with every single investment, is what actually happens. Second, we are setting bold goals of achieving new and attainable measurable outcomes. These goals include a 50% reduction in our January 2024 baseline of those living unsheltered by December 31st, 2025. In this 2-year period, we'll create a measurable and achievable difference in the lives of at least half the people living unsheltered right now. We'll get people housed and we'll get people stabilized. And we're going to reduce racial disparities in our homeless populations by targeting populations currently disproportionately experiencing homelessness. The proposal includes better coordination within our systems to move people from shelter to housing, increasing exits from shelter to housing by 15%. Lastly, we're going to make sure 75% of people housed in permanent supportive housing retain their housing 24 months after placement. Once someone is stabilized and housed, we're going to make sure that they stay there. Third, we're using a multifaceted, coordinated approach that makes homelessness the priority it must be across a coordinated system of jurisdictions, providers, and programs. This change in our approach to governance, accountability, and collaboration will yield the bold goals that I've outlined above. Because the impacts of homelessness are felt across many areas of our work, from unsanctioned encampments to our first responders to the healthcare and justice systems. We need coordination across all of those areas, and this approach will do that for the first time. So this homelessness response system will include a focus on unsheltered homelessness, health and recovery, supportive and affordable housing, and crisis response. We know oversight will be needed, which is why we're creating a steering and oversight committee connected to both of our governments with equal representation from the city and county, along with a seat for our East County partners. Because we know we can absolutely not do this work alone, and it won't be successful unless the right people are involved. This group will set strategy and key performance indicators, monitor progress to ensure alignment of investments, and help us make appropriate adjustments to our annual goals so that we can stay true to our overall goals. The mayor and I will serve on this committee, along with the city and county commissioner, and East County city elected and non-voting members, including from Metro and coordinated care organizations. And successful implementation will be driven and directed by administrators from across the system whose work will help us make the right investments and keep the work moving forward. This group will include the county COO, the city's administrator, and key department heads from the Joint Office to the Portland Housing Bureau, from our health department to the community safety director. We'll have leaders from healthcare, Trillium, and Metro Housing as well. Its mission will be to operationalize plans and bring the full combined focus to our systems into alignment, meeting on a monthly basis to problem solve, monitor progress, hold each other accountable, and work together. The right people being involved in this work requires the community to be a bigger part of this work. So this governance will include a community advisory committee. Our advisors will include people with lived experience with homelessness, representative from the business community, labor organizations, service providers, housing providers, first responders, and others who find this kind of advisory role meaningful. This committee will be responsible for reviewing and recommending strategies, plans, and outcomes, and being our eyes and ears throughout the many communities our homelessness response system serves. This will also be one of the best ways we'll identify emerging community needs and opportunities. And we will ask this committee to serve as the Joint Office's County Budget Advisory Committee during our budget process to make sure that there's alignment of priorities throughout the year. All of these efforts will help us make the greatest impact with the most accountability. It will ensure that our partnership has the checks and balances that it needs. For the many people in this community who have long hoped Multnomah County and the City of Portland would once again be growing in the same direction, that day has come. For the many currently living unsheltered or in unstable situations, I want you to know that I care about you, that your governments care about you, and we are committed to meeting you where you are and walking beside you as you take your next step. I want to take a moment to thank Governor Kotek for her strong support of this plan, and I want to especially thank Mayor Wheeler and his team for working closely with Multnomah County, with my team, to coordinate this new set of approaches. My hope and expectation is that this comprehensive approach with clear goals, oversight, and accountability towards addressing homelessness will be embraced and supported by both our boards as we move forward in the IGA process and towards a better future for both Multnomah County and the City of Portland. And now I am pleased to turn the podium over to Mayor Ted Willer.
Thank you. Appreciate it. Well, good afternoon, and thank you, Chair, for hosting us all and bringing us here today. And I want to thank you for your extensive collaboration on this agreement. Today marks a new beginning and a reset of the table for how the City of Portland and Multnomah County work together to address the #1 issue facing our community. That is, of course, homelessness. All of us have a stake in making our streets safer and connecting homeless Portlanders to services and housing. We know it's the #1 issue for Portlanders. That's not in dispute. We hear it through constituent emails, calls, public meetings, conversations with local business owners, surveys, polls, and all of us who hold elected office hear it everywhere we go. Public health experts have told us that it's critical that we spend the next few years strongly focused on addressing the crisis currently unfolding on our streets. We need to improve our outreach systems and better coordinate across service providers and jurisdictions. We need to urgently provide more shelter options and get people into safe spaces where they can stabilize, where they can access critically needed services, including, of course, behavioral health services as well as housing navigation. And we need to continue producing affordable and permanent supportive housing to provide places for people to reside long-term. In September, I spoke right here in the county boardroom about the need to improve the way we collaborate on our response to the homeless crisis on our streets. At the forefront of that discussion was the Joint Office of Homeless Services, as well as the Intergovernmental Agreement, or IGA, that defines our collaborative efforts. I stated that it was critical for us to redefine the relationship between the city and the county by examining the way that we structure future IGAs. The city, of course, manages public space and land use, We oversee the first responder system, and we work to develop affordable housing. That's our traditional lane in this area. The county, of course, leads Health and Human Services and runs the administration and the operations of the Joint Office of Homeless Services. Therefore, as I said in this room before, and I will say again now, we must work together. We must collaborate. Neither government can solve this independently of the other. We have to bring all of these services and all of these efforts together. We have to do so seamlessly, and we have to do so effectively. As the current agreement on the Joint Office is set to expire next summer, my administration has been in discussions with the Chair's office on how to best re-envision this relationship. I cannot underscore how much effort has gone into this collaboration. Through the hard work of many from both the city and the county, we've set new agreed upon terms that will guide the development of the new draft agreement that will govern how we will work together on homelessness issues through 2027. The revised agreement that we're announcing today helps address all of the concerns that I raised in September. This new IGA will establish, as the chair indicated, clear goals with measurable, achievable, and reportable outcomes. The work will be informed by specific data from the Built for Zero model, a client-centered public health approach to guiding clients through the entire continuum of care. To ensure measurable progress, we'll work to identify a specific baseline number of people experiencing unsheltered homelessness as of January 2024 through the Built for Zero by name list. Our clear goal is a 50% reduction in the number of people experiencing unsheltered homelessness by December of 2025. Furthermore, we're aiming to increase exits from shelter to permanent housing by 15% by the end of 2025. We're working to ensure that at least 75% of people placed in permanent supportive housing retain their housing for at least 24 months after placement. The new IGA will also feature an improved budget process. The Joint Office will present comprehensive budget proposals to both the city and the county, and there will be greatly improved collaboration and communication at the staff level. Additionally, the Joint Office will now provide a quarterly progress report to the city government, to the county government, and to the public at large. This will ensure that valuable data is up to date and available to those making policy decisions and those in the community who care deeply about making progress on this important issue. My confidence in this partnership is further strengthened by the new governance model just announced by the chair. This governance model ensures that our entire homeless response system is a truly collaborative and joint effort. To honor the spirit of the collaboration, I'd like to take a moment to thank my colleagues on the Portland City Council for their support of this process. Commissioner Dan Ryan has successfully led the development of the city's Safe Rest Village program, a program that now features 7 sites across Portland and provides hundreds of shelter spaces. Commissioner Carmen Rubio has led on issues surrounding affordable housing development and continues to focus relentlessly on ways to improve the stock of affordable housing in our community. It was Commissioner Renee Gonzalez's suggestion to reestablish and reset a new IGA instead of amending the previous version, a key feature that will ensure stability and clarity. And Commissioner Mingus Mapps has provided support as well as land for the city's temporary alternative shelter sites program. In closing, I'd also like to offer my very sincere thanks to Chair Jessica Vega Peterson, Commissioners Julia Brim Edwards, Jesse Beeson, Lori Stegman, Sharon Myron, and of course, Joint Office Director Dan Field. I've spoken to all of you directly, and you've shared great insight and wisdom and have helped guide the document that we are releasing today. Thank you for your dedication and your participation. Between ourselves and our staffs, we've had dozens of meetings and spoken at length about how to approach these issues. We're all here today because we believe in the necessity of this work, and we know that this is what the community expects us to do. We're united in our determination to find compassionate as well as effective solutions to lift up the most vulnerable in our community. This marks the beginning of a new relationship, one that is reinvigorated, one that is collaborative, one that will improve these operational systems, build more options, and provide more services on site at shelters. Now, let's not kid ourselves. None of this will be easy, but we are far more likely to succeed when we work together. This is what Portland needs, and it needs to be done with urgency. I look forward to this new chapter for the City of Portland, one that is guided by clear and measurable outcomes, and I'm hopeful that we will make considerable progress in the months and the years ahead. Thank you.
And we have a few minutes for questions, so please ask and indicate who you want to speak to. Alex.
Sorry if I'm too far away.
You're fine.
I wanted to better understand how the joint office's budget would operate or be decided upon under this new proposal. I know in the past it's been a little tricky figuring out who's making what decision. I know this overview had said that there's two different portions that each, the city and the county will each vote on a different portion, but I'm wondering if you could explain what that would look like.
Sure. So I think the important thing to start with is that the city and the county both currently put dollars into the budget of the Joint Office of Homeless Services. So that part really isn't going to change. What we want to make sure happens is that the information about the budget is being shared in a timely way with both the city and with the county so that we can be making policy decisions and have insight into that ahead of time. And so there are some specific pieces in there around the budget itself, so enhanced budget collaboration to scope and fund shared goals, desires, outcomes, and contributions, so that the joint office is going to present its budget to the city at least 60 days before budget adoption, and then each jurisdiction is going to approve their own portion of the joint office budget, but that there be more collaboration from staff as we go through there. I think the other piece of it is, as we're setting up the 3 different committees as part of the governance, the conversations that are happening at those tables in terms of identifying what is needed, some of the strategies around that work is also going to inform the budget decisions that are made for the joint office.
Just to follow up on that, what is the split then? I think Alex was trying to get to the fact that, what is the split? In other words, out of 100%, how much is the county putting in? How much is the city putting in? And what are those numbers?
So we have we can provide you numbers for our current budget and what that looks like. And then the FY25 budgets are still TBD. We haven't even started that process yet. I think, I think one thing of note is that before the beginning of the joint office, the city was actually putting in more dollars to the homelessness response system than the county, just because they had, they were because of the population they were dealing with. So I don't have a specific answer. I think the thing to know though is that the dollars through the supportive housing services measure comes through Multnomah County. So we have responsibility for allocating those dollars. And so from, I guess, that perspective, you can see that the county is providing more dollars. But frankly, part of the efforts that we're doing today and part of what's in this plan is the fact that we want to have a homelessness response system strategy that is really independent of who's putting the dollars in, but really shared goals and strategies around the investments that we need to make.
And if I could
Go ahead.
jump in
Yeah.
on there, I agree of course, with what the chair just said. First of all, we don't have that answer yet. This is the framework for how we're going to collaborate to get to that answer. And what I've seen over the course of the last year is an unprecedented level of budgetary collaboration between the city and the county. It hasn't been perfect. I've certainly expressed my frustrations. I think the chair has expressed her frustrations. But at the end of the day, as we look in the rearview mirror, what we see is that the county has put over $20 million into our task sites, something that we didn't necessarily envision or foresee previously. The state has put funding in. What I am most excited about in this framework that gets to the answer of the question that you mentioned is we have this Homelessness Response System Steering and Oversight Committee, which, as the chair said, serves as a back to the Joint Budget Advisory Committee, to the Joint Office of Homeless Services. Sitting at that table will be all of us. The city will be there, the county will be there, East Multnomah County will be there, people from the community and the business community will be represented in those efforts. There's actually a subcommittee that I believe will have 13 individuals representing the community that will also advise that committee. And so for the first time since I've been mayor, and I've been mayor now for 7 years, we're actually going to have a collaborative budget process. In terms of who puts in more or who puts in less, the answer is the county will put in more. They'll put in substantially more because through their county operations, they receive funding from the supportive housing measure, the supporting service measure. The city doesn't receive any of that. So funding will always go through the county for that. Additionally, we're not the public health authority. The county is the public health authority. So they provide behavioral health services, they provide mental health, substance use disorder treatment, public health services, and they have access to federal and state reimbursements through Medicaid that we don't have access to because we're not the public health authority. But where we can be really helpful is in those areas where we're managing the public spaces, where we are providing innovations or support through sheltering capacity. Our Safe Rest Villages and our task sites have been significantly expanded over the last year. I think we've created something like over 500 new shelter spaces. But the chair and I, we don't want to just create shelter anymore. Shelter alone won't work with a chronically sick population. It has to be combined with case management and services and navigation. And so the homeless services structure that we're talking about today and jointly funding, probably with the county putting a lot more in just because they have the SHS dollars and we don't, is a truly unified structure that makes sense for the kinds of problems that chronically homeless people are currently experiencing on the street. These are not folks who are exclusively people who have lost jobs or lost housing due to rent increases, although there are plenty of people like that. We are dealing with a much more chronically sick population that needs intensive services and case management. And for once, we're going to be sitting at the table at the same time, hearing the same information, looking at the same data, and brainstorming on where do we want to prioritize our budget, what services do we want to prioritize, who does what when, and how is it all funded. And so I'm really excited about the possibility here. And the best part, I think, from your perspective, maybe, I'm guessing, is it's all going to be public. And so you can help hold us accountable in terms of the data, the information, the goals we've set. And we're all going to see as a community whether we're being successful or whether we're not being successful. Areas that we are being successful, areas that we aren't, that we need to retool and refine. And instead of a bunch of finger pointing, we're all going to be sitting around the same table looking at each other and working together to resolve those problems.
Going off of that, we hear so much about affordable housing, more shelter, but the underlying issue out there is addiction. How can we possibly house all these people without enough addiction services?
Yeah. So I appreciate that. I mean, we absolutely need more affordable housing. We don't, I mean, even that, just that aside, we don't have enough places for people to live that they can afford. So that continues to be a key thing. But just as important is making sure the people who need treatment, who want to have treatment, whatever that looks like, whether that looks like going through detox, going into a treatment program, having a place to go while they're in recovery. All of those things are investments that are needed. That's why I'm most excited about the part of this structure that we're proposing that is what we're calling right now the implementation committee, where we're actually having the folks who are responsible for putting those kinds of things into action at the table together as we're talking about our homelessness response system. So it's folks from our Department of Health and our behavioral health folks, but it's also some of our CCO partners, our healthcare partners. I think it's going to be really important as we're talking about what we need in our community that we have, that we're sharing that information with the state, because they're a part of these systems that the state is responsible for as well. And it's not just the behavioral health folks and the healthcare folks that are going to be at the table, but we're also talking about some of our justice partners. We were talking about housing, the housing folks at the table. We were talking about our crisis response system partners at the table, so that we can be really taking a look at this holistically as we're talking about what the system needs and how each of us can be a part of making that solution.
And going back to the budget portion, many people have called on the city to stop funding the joint office, because essentially we have the city spending millions of dollars on the joint office. The joint office sends that money to nonprofits, which then provide tents, and then the city spends millions removing those tents and even faces lawsuits for them blocking sidewalks. So I mean, are we gonna find out another way to do this so it's not so convoluted and backwards?
Well, I'll answer that. I also want to answer your first question, but I'll answer them in reverse order. Yes, it should not be so convoluted and backwards or Byzantine or hard to figure out or difficult to follow the dollars or identify the scope of the problem or be very clear and public about what our results are. So the answer is, I believe this program helps us streamline the goal setting, the data management, the by name list, and working off of that as our basic data source is a huge improvement in terms of making sure we're delivering the right services to people that they need to get off and stay off the streets. And of course, what has changed, and you said it right, you said addiction is the significant issue we're facing. Data shows two things to be true, and that is the longer that people are on the streets, the more likely they are to develop a substance use disorder, and the more likely they are to develop mental health afflictions. That being true, then part of the answer has to be to get people out of those unsanctioned, potentially dangerous, potentially squalid conditions in unsanctioned camps and into something else. And for me, it's the task sites where they immediately are assigned case management. They are immediately connected with services that they individually need tailored to them to help them stay off the streets, whether it's mental health services, whether it's the substance use disorder, whether it's job training or public health or access to veterans benefits or Social Security or anything else. We're finally following individuals through the system and connecting them individually with what they need tailored to their needs. And we're measuring it all, and we're being clear about it. And we couldn't do that without the county. The county, by virtue of its status as the public health authority, has to help the city. So when people say, well, you just pull out, take your $42 million out of the joint office and run the task sites or run Safe Rest Villages on your own, my response to that is, they're not really what we envision if the county isn't providing those public health and behavioral health and navigation services. To me, that's the critical innovation and the difference between the way we're serving the population today versus what we were doing just a few years ago. It's now individual, tailored, comprehensive problem solving, the goal being not to just keep people in camps that we create indefinitely, it's to move them through because they're getting better and they're reconnecting with their lives and their future. That's the goal. And this collaboration makes it far more likely that we'll be able to achieve that vision. That's what I wanted to see. It's what the chair wanted to see. And the more we talk about this with our colleagues, we realize this is what they want to see too. So I think this is a huge, huge improvement.
Thank you, Mayor. And I just wanted to address the question about the tents and the tarps. I think a lot of the information that has come out, especially when you talk about the millions of dollars were spent, that was really looking at all of the different spending that went into and the investment that went into that during COVID, when the healthcare direction was really don't move people, and especially don't pack people into congregate shelters, because that's much more likely with a very medically fragile population to produce COVID. I think, but I do want to say this, because we are starting the winter season where we know we are going to have extreme weather, extreme conditions. We are honestly talking about people's lives and what is needed to protect them. The county will do the work that we need, the city will do the work that we need to make sure that there are places that people can go during those extreme weather events, but not everybody chooses to do that or can do that. So we want to make sure people have some of the life-saving supplies like tents and tarps and blankets to make it through that. And that's just a humanitarian response that we will continue to do. Thank you.
So then will the city not be removing those tents?
Blair, Anthony had his hand up, I'm sorry. We could follow up after.
Okay.
I'll follow up on this right now. Look, my goal has been very clear. We will not have unsanctioned homeless camps in the city of Portland. We are moving towards that goal. But just moving people from one neighborhood to the next is clearly ineffective. It's not helping anybody. It's not helping those on the streets, and it's not helping the community at large, because it's not actually solving the problem. So, in addition to maintaining clear and usable public spaces that the public expects. They expect safety, they expect environmental protection, they expect to be able to access public areas. We are also creating an entire suite of services to humanely connect people, those that we're moving. We give them the option to come in and receive the services they need to address whatever issue has led them to be on the streets in the first place, whether it be a health issue, whether it be an economic issue, whether it be something else. And so I think these two pieces combined is a very powerful formula for success. We are going to maintain our public right-of-ways. We owe that to the public. Safe, clean, livable public right-of-ways. And frankly, we have a lawsuit that insists on it through the disability community, but we're also achieving what the public has told us they expect, which is compassionate responses for those who have been on the streets. And this model now allows us to combine the best of all worlds. It's not just the city with our enforcement or our desire to maintain public spaces, or our first responders who are coming in and doing a quick intervention. It is now a pathway to success to connect people with the services they need to get off and stay off the streets. It's hard work, it's complicated, it's not inexpensive, but it works. And we're proving that through the task sites. And again, we can't do this independently. We have to work together as city and county, and frankly, the state does too. The state needs to be part of this solution, and I'm pleased that the governor has lent her support to what we're doing here today.
We've got time for a few more questions. Anthony and Nicole.
Hey there, thanks a lot for your time. Could you describe how involved the folks from Built for Zero were in this plan, and what you tapped in terms of their resource? And then could you describe how your data collection going forward might be different from point-in-time counts or HUD by name lists? Are you going to use any of the other resources that Built for Zero advocates for getting better data?
So now we have certifiably smart people. And Dan, you might have something on this too. Skylar, why don't you go ahead and start?
Hi, everybody. Sky Brucker-Knapp. I'm a senior policy advisor for the mayor and Stacy, and I've been working on these issues together from the city and the county side. So I'll just say quickly, colleagues from the city, from the joint office, from Metro, and the county actually went to a Built for Zero conference in DC a couple months ago. And so there we connected with a lot of folks who we're already working with on a lot of these issues. The joint office data team has been really instrumental in this work for years. And so a lot of those practices and policies that Built for Zero is instituting around the country are a part of this plan, and also how we're working with the data set that we have. So this is by far the most quality data set that we've ever had, and we're really excited about that. And creating these metrics built on that data set, we know we can actually address the needs of folks in the community. But I don't know if you have.
Are you doing anything different on the ground?
Yeah, so, well, one example, obviously, is trying to get folks who are able and have all the documents they need, don't need intensive case management support directly into housing from the streets. And for those folks who aren't able to go right into housing, we want to make sure we have the options of shelter. So working with the Built for Zero folks to really analyze each individual's needs and doing that client-centered approach is something that's new.
I'll add one other thing, Anthony, which is one of the biggest challenges I think that we've had as a community is being able to equip outreach workers with the technology and the tools to be able to collect data in the field and on the streets. And through Housing Multnomah Now, that was one of the biggest shifts and inclusions in that strategy was to make sure that outreach workers who were in the field were able to capture information, get folks enrolled, and ultimately get them connected to services. And so that data will pull through and that work will continue and expand.
Nicole.
Yeah, speaking of Housing Multnomah Now, we've seen that progressing quite slowly. So I guess, given the lofty goal of reducing unsheltered homelessness so significantly, what lessons are you taking from that new program, and how are you applying it or changing it for this upcoming year's goal?
I'm sorry, I missed the first part of the question.
Given that Housing Multnomah Now is progressing so slowly, how will things change? How will we actually see that unsheltered goal?
Yeah, I think all of this has been learning. The progress that we're making in Housing Multnomah Now has really increased in the last several months, and I think part of that is getting the right people into the positions of leading the program. We have Deanna, who's a really fantastic person who's leading that work now. I also think there have been a lot of good innovations during that work, and Stacy just referred to, for instance, the technology that's being used to gather the data. But most importantly, I think that what we have learned from that program and what we're able to do by this is really built on the confidence that we have in the changes that are happening with the Joint Office, the conversations that we have had over the past year with the providers in terms of freeing up some of the obstacles and roadblocks for them being able to perform what we need. So and the county has been very responsive to that in terms of the allocations that we made this fall, for instance, for $10 million in grants to help directly with providers with some of that. Investing in shelter flow through, so we're helping move people more effectively through shelters and into housing, and then really using resources to help support people in housing so that they can stay there successfully. So I think all of those things together are really learnings that we've had and momentum that we have as we're really achieving these new goals. And I will say, like, for me, I have zero interest in putting numbers out there or setting goals out there that we have absolutely no chance of achieving. I think we need to be ambitious, we need to be audacious in the goals that we set, but we have to make sure that we are being accountable to them and that we feel confident in that, because we owe that to the public and we owe that to the people who are experiencing homelessness.
I think we have room for maybe one more question after.
Can you talk more about what specific existing programs are going to be transferring under the Joint Office? Is that like city-run programs with the task sites or county-run as well?
Yeah, so, and I want to be a little careful here, we're talking longer term, so it won't happen immediately with the adoption of this IGA, but I think there's broad acknowledgement that ultimately it should be the county that is operating the Safe Rest Villages and the task sites, given that the critical services provided on those sites are in fact county-related services. And again, part of the beauty of that is that the county has streams of funding to support those efforts, whereas at the city level, it's coming out of our general fund and competing directly with police, fire, emergency management, and other critical city services. But none of this is going to be done without full collaboration and partnership. So we've really only begun these conversations. And frankly, we've started to collaborate in ways that we haven't previously. You know, we're now using the task site as one of several vehicles to get people in through Housing Multnomah Now. We actually have people coming through the task sites and being connected to services. So you're already starting to see an integration of the efforts at the city and the county level, and then the broader question we have to have in the steering oversight committee, I got the name wrong, but you know what I'm talking about, the committee. Those longer term discussions now will be done with all of us at the table saying, look, who does what, when, with what source of funding, and what are the collective outcomes we all expect from those outcomes. So again, this is a framework, but it's a necessary framework to be able to do the kinds of work we're doing now.
We got our last question, and Pat, you had your hand up. Take us home.
So it's a three-part question since I only get one.
That's clever, I see what you did
It's
there.
distributed across KGW. Let's think of that.
So number one, with this baseline that you're going to get, why not just use the point-in-time count? And if not, what will you do? Second, when will these dashboards be available to the public? When will it be available to your workers out in the street, the daily openings or non-openings? Are there dates for those? One of the goals is to have people, 75% stay in the housing 2 years later. What's the percentage now? Those are my questions, thanks.
So I don't know the answer to the last. We'll get you that. You know, I think that, so your first question was why not just use the point in time count? I think the point in time count is a good, it is just what it is, right? It is a point in time count. But what we have now is we have data that is arguably better than it's ever been. And in addition to the data point of point in time count, we do have the work that we've done to build a by name list, the partnership that we have with Built for Zero. And so we have a much better picture than just relying only on the point in time count. We have other sources of data, other information that we're using to create a more accurate point of what that number looks like. It's not perfect, and we are continuing to work and refine and improve that. But we want to make sure that we're using the best set of data that we have right now, and that's the point in time count plus the by name list and information that we have in HMIS.
So, and you guys may have some added commentary there.
Thanks for the question on the long-term housing retention. So at the end of the most recent annual report for the supportive housing services, 99% of people in that year retained their housing. We know that this is going to be a much larger population, and we want to ensure that we're continuing to press on that and not have people recidivate back into homelessness ultimately, but that the services and supports that they need to stay in housing are continued to be provided.
You don't have a number now for what the 2-year retention is?
Not for 2 years, we just have our 1 year, but we can certainly provide that. It does exist.
And I could just say quickly the dashboard, so not to get too in the weeds on it, but there is ARPA kind of federal requirements for the SRVs and the task site dashboards that are on the city website. And then part of that collaborative budgeting process is going to be that budget dashboard. So last year we actually worked with the county's budget office to get our city commissioners the numbers and on an actual program basis. So something we hadn't really seen before, where all the money was going, exactly which program. They were really helpful and supportive and worked with us on that. We want to see that go forward, and that'll be publicly available as well, I believe. So I think that collaborative budgeting process happening between the city and the county budgeting offices has already started, and then it will happen on a quarterly kind of reporting basis and then be available publicly.
Thanks, everybody, for being here. We're here for follow-ups. If you need, let me know. I can get questions routed to people, and appreciate your time. Thank you.